Okay, let's talk about herd immunity. So herd immunity is a term that was coined several decades ago, mainly in the context of immunization. So they wanted to see if we immunize a certain portion of the population, will that give a protection to people that aren't even immunized? So a lot of people don't like the term, a lot of immunologists and epidemiologists don't like the term herd immunity because it doesn't give everyone immunity. Some people say it should be called herd protection because basically if you have enough people that are immune to the disease, they can form kind of a barrier and protect people. So I found this little graphic here. It's at Reuters. I'll link it below. And basically you can play with three sliders here. So vaccine effectiveness, vaccination rate, and the R naught, or R naught is also called the basic reproduction number. And let's talk briefly about basic reproduction number. Basic reproduction number basically means each infected person will infect this number of people. So if R naught is 1, then each infected person will infect one other person. So if R naught is 1, basically the level of disease in a population will stay the same. It'll be stable because each person will just infect one other person. If R naught is less than 1, then the prevalence of disease in the population will go down because each person will infect less than 1. I mean, obviously you can't infect less than 1, but on a population, on an average level. So then if R naught is 2, then what you'll have is each person infects 2 people. Then so it becomes like 2, 4, 8, 16, 32, 64, 128. So it rapidly gets bigger. And so R naught, just basically if you crank it up to, really high, then you see that this thing takes over the population very quickly. If R naught is like 1.3, then so like the R naught for flu is around 1.3. So you'll get very slow spread of disease. Now, there's many ways to calculate the basic reproduction number, and I don't really know how it works, but there's many different methods by which epidemiologists calculate the basic reproduction number. And the basic reproduction number for COVID has been thought to be about 2.8 to 3. And this basic reproduction number is partially a product of the disease itself, how infectious it is, and partially it is a result of any mitigation measures that the population does. For example, no matter how infectious the disease is, if everyone stays in their room by themselves and doesn't see anyone else, the R naught will drop to 0 because each person will infect no one else. So mitigation measures can change the R naught, but this is the R naught for COVID when there are no mitigation measures. People are just going about their life as usual before the pandemic. It's about 2.8 to 3. So let's peg it at 2.8, and then vaccine effectiveness, according to the preliminary phase 3 trials, is about 95% for the Moderna and the Pfizer vaccine. And so let's see what happens as you crank up the vaccination rate. Let's say you get 40% vaccinated, 45% vaccinated. Then all the dark circles are the vaccinated people, and the light color are the light blue is the unvaccinated people, and then of course you see the disease spreading through the population. So you see a 45% vaccination rate with a highly effective vaccine protects a large amount of the population, but you get a large amount of the population that still gets infected. And so let's see, if you have it down to like 30%, you'll see the difference. Yeah, so you have pretty rapid spread, and almost everyone who's susceptible gets it. So you see very few light blue circles are left. Whereas if you turn this up to, let's say 60%, or let's see 70%, 75%. So if you have 75%, you'll see that it basically stops the disease. There's a wall of immunized people around each infectious nidus. And see, it stops it cold. So this is what's called herd immunity. Now you've got enough people that are immune to the disease that the disease itself cannot spread very far because it just keeps running into people that are immune. Okay, so this is a great primer on herd immunity, and I'll link this paper below if people want to get a little more in depth into it. But basically, this is the formula for calculating what the herd immunity threshold is. If you know your R naught, or the basic reproduction number, then you do the reciprocal of the R naught and subtract that from 1. So let's say if COVID is 2.8, if this is true, you take the reciprocal of it, then you subtract that from 1. So I screwed that up, sorry. So 2.8, take the reciprocal, and then we'll subtract that from 1. That becomes 64.3%. So if the R naught is 2.8, you would expect that you would need about 64.3% of the population to be immune for you to get a herd immunity threshold. So, let's try something else. If it was 3, then you would need 67%. So, as the thing is more infectious, the threshold for herd immunity goes higher. So, nowadays herd immunity has been used in the context of natural immunity. So they're saying, if you let the disease go through the population and enough people get the disease and then become immune naturally to the disease, then you will achieve herd immunity without a vaccine, or maybe with some combination of the vaccine and natural infection. So a couple of places have tried this method of dealing with the pandemic, either on purpose or inadvertently. One of the places is a city in Brazil called Manaus. I don't know if I'm pronouncing that correctly, but Manaus right here. This is a city in the Brazilian Amazon that has a population of about 2.2 million, and early in the year, like March, April, they had an uncontrolled outbreak, and it was terrible, and the disease went through their population, and several papers were written. Like, this was a paper written back in September, and this is a paper written in October, and basically they suggest about 66% of the population was infected and is theoretically immune, and they think that the unusually high infection rate suggests that herd immunity has played a role in stopping the progression of the disease. And so in here they say that they expect about 65% were exposed, and that future waves of infection are likely to be much less pronounced than has already been experienced. Now that sounds great. And then here's a more recent paper. This is a paper that looked at blood donation levels. They tested the blood that people were donating at blood donation centers in this city, Manaus, more recently, like in the fall. And they suspected that about 76% of the population had antibodies, based on extrapolation from the blood donor data. So, there's a lot of problems. There's probably some sampling error. The people who donate blood aren't completely representative of the population. So, but anyway, in this city, a large proportion of the population was infected, and they had about almost 3,000 deaths in this from COVID in this city, which is like 1 in 500 to 1 in 1,000 people died from COVID, which is a lot of people. If the same thing happened across the entire United States, we would be seeing probably like 700,000 deaths or more. So in this one, they're saying that there's a high population that was infected, and so you would expect that they would not have any more. They had reached herd immunity, but more recently, like here's a article out of like right before Christmas, and they got hit again pretty hard. And a more recent article, January 14th, they're getting hit so hard again in the winter, it's that they're running out of oxygen supplies. So it appears that herd immunity has not been reached in this population. Another country that kind of pursued the herd immunity paradigm, and this one on purpose, was Sweden. And you probably remember in the middle of 2020, there was a lot of papers about the Swedish strategy. They were letting people especially the younger, healthier people, get immune by being exposed. And the public health official said, in the winter, when everyone else is going through their second wave, we hope to not have a second wave. So that was Sweden's strategy, and unfortunately, they did have a second wave. You can see right here, starting in November, they're having like up to 10,000 cases a day, 11,000 cases a day. So that's a lot of cases. Compare that to a similar country, which is Norway, the next country over. They had a second wave, and they're doing mitigation strategies, and they're hitting like 500-600 per day. So they both have a second wave. Norway is like 10 to 20 times less. Now, the population of Norway is half of Sweden. So if they have exactly the same amount of COVID, you would expect Norway to have half the number of cases, but they actually have 10 to 20 times less. So what's going on here? Why is not herd immunity working in these cases? Well, number one, I don't think Sweden actually hit a threshold where they have 70% of their population immune. This city in the Amazon in Brazil definitely, got fairly high penetration of the disease, so 60 to 70%. So they should be getting it. So a couple of things could be the problem. The herd immunity idea works with a couple of assumptions. One assumption is that people will not move around very much. So, you see these dots, they stop, but if this dot moves over to this dot, it can start a new wave, or if this dot moves over to this dot. So if people move around a lot, even with a significant portion, the chances of someone who's infected hitting a susceptible person is pretty high with a lot of movement. So if you have a lot of mixing of people, then you need even higher numbers of vaccination or immunity to achieve herd immunity. And so Manaus is a pretty poor country with lots of crowded conditions, a poor city, and so they have a lot of mixing of people. So that's one of the reasons. The other thing is that it assumes lifelong immunity. So if you have lifelong immunity, then you hit the wave, and then you get permanently immune, and then all the people that are permanently immune cannot get infected again, and then the disease peters out. What happens is if immunity lasts less than permanently, you'll have cycles, because the immunity will knock the disease down to very, very low levels, and then people's immunity will run out, and then they'll get hit again. Then immunity will run out, and then they'll get hit again. So that's the other thing. As long as immunity is not permanent, there's a chance for the disease to spike up again. And the last thing is it assumes that the virus does not change, and so the immunity that you have to it can still attack future viruses. Now, we hear all these reports of the new variants, and it's unclear if the new variants can evade the immunity from either the vaccine or from natural immunity. But if that does, then all the previous immunity doesn't help, so it doesn't add to the herd immunity. So that seems like a fairly bleak picture, but what we don't know is, maybe with the vaccine you'll get partial immunity, and that may just at least slow down the disease. So that would be like if you threw the slider down a little bit. And so as long as people are immune either naturally or through the vaccine, even if the effectiveness is not 100%, it's still fairly good at stopping the disease. The other thing is luckily the disease is not very fatal, with a infection fatality rate probably far less than 1%, probably less than 0.5%. I think the most reasonable estimate is like 0.3%. So most of the people that are susceptible will be hurt in the first wave, and eventually at a population level we will learn to deal with a disease with this amount of lethality. And then, like we pointed out in previous videos, there's many things that you can do personally to protect yourself from the disease, and mainly it is to improve your overall health. It's well known that the disease affects people with health problems, diabetes, obesity, heart problems, lung problems, those things. So if you can do things to improve your own health, then that helps it. But herd immunity basically is going to help, but it may not be the ultimate solution for this, depending on how long our immunity lasts and how quickly the virus mutates to evade immunity, which hopefully won't be very quickly. So I hope that was helpful, and I will link all these articles in the description below. If you have any questions, please feel free to ask, and thanks for watching.